Hi, I'm Dr. Kavita. Please do watch, share, subscribe to my YouTube channel. Today I'm discussing how smoking affects upper GI bleed. Smoking is a significant risk factor for upper GI bleed and associated with both increased incidence and worse outcomes in these patients. Some of the key points are: first one, increased risk of recurrent bleeding and readmission. Patients who smoke cigarettes have a modest but statistically significant higher risk of 30-day readmission due to recurrent non-variceal upper GI bleed after hospital discharge. Second one, there may be a higher overall risk of major GI bleed. Current smokers have more than double the risk of GI bleed compared to never smokers. What is the mechanism? Smoking impairs gastric mucosal defense by causing mucosal cell death, reducing blood flow, interfering with immune responses, and delaying ulcer healing. It also increases susceptibility to Helicobacter pylori infection, a major cause of peptic ulcers and upper GI bleed. How does it impact on ulcer healing and treatment? Smoking slows peptic ulcer healing and reduces the effectiveness of ulcer medications, further increasing bleeding risk. What are the clinical implications? Smoking cessation is crucial in managing patients with upper GI bleed to reduce recurrence risk. Identifying smokers at high risk may guide preventive therapies including Helicobacter pylori screening and eradication. In summary, smoking is a modifiable and independent risk factor that increases the risk of upper GI bleed, worsens outcomes, and complicates treatment. Quitting smoking is an important preventive and therapeutic measure in patients with or at risk of upper GI bleed. So, medical students, what do you read about? How does smoking affect patients with upper GI bleed? How does smoking increase the risk of upper GI bleed? How does smoking increase the risk of recurrent upper GI bleed and readmission rate? What is the mechanism that impairs gastric mucosal defense when a patient is a smoker and has upper GI bleed? What is the impact of smoking on ulcer healing and treatment? What are the clinical implications? Thank you.